If you're a CrossFitter dealing with knee pain when you squat, I've got some good news for you. You don't have to stop training, you just have to train smarter. And today I'm going to talk about exactly how you can do this. I'm Jeff Lewis, owner of Lewis Physical Therapy and Sports Rehabilitation, where I've helped injured CrossFit athletes over 30 get back to RX workouts through the Lewis Performance Rebuild method. First, it's important to understand that not all knee pain is the same. Some CrossFitters struggle with patellofemoral pain, which often presents as pain underneath or behind the kneecap at deeper ranges of squatting. Others might be dealing with chronic meniscal injuries, which can be more of a deeper joint line ache or even a painful clicking sensation. You can also have acute meniscal injuries if you have, say, a sudden twisting event like when you're jumping on or off a box during a WOD. And then there's tendinopathies like patellar or quad tendon pain. These tendon issues typically are painful at certain ranges of knee flexion, feel worse when warming up for a workout, and typically feel better when you're warmed up. However, if not addressed over time, these tendon problems can become debilitating enough regardless of how warmed up you are. Each of these conditions requires a slightly different rehab approach. For example, patellofemoral and meniscal injuries, you might typically focus on exercises at less degrees of knee flexion with a heavy emphasis on posterior chain or glute strength and single leg stability. With tendinopathies, on the other hand, these are going to require sufficient loading at progressive intensities throughout the entire process. And with tendon issues, it's okay if you start with some small amounts of pain, say less than a 3 or 4 out of 10 in the early stages of rehab. That is okay to tolerate that. So how do you keep training while respecting those pain-free or relatively pain-free ranges? Let me show you these 3 key strategies. Box squats. For athletes that have knee pain with traditional barbell squats, box squats can serve as a great way to continue training under load. The box will serve as a cue for greater hip hinge movement, which in turn will limit the amount of knee tracking, essentially known as anterior tibial translation, over your toe. And it'll ultimately help limit depth as well, when we know that depth can sometimes, for some injuries, be a provocative factor for their knee pain. Quarter or half squats. So once an athlete is able to perform box squats under load without any issue, or even bodyweight squats at full range without issue, I like to implement some type of quarter or half squat. This is now going to help stress the lower limb both concentrically and eccentrically, so you can't use the box to decelerate you, but you are still going to minimize the amount of depth that may provoke those symptoms. So these can be really helpful early in the rehab process to minimize depth but still get some load exposure. Posterior chain emphasis, this is something throughout the entire rehab process that you should focus on identifying any weaknesses in and then targeting them throughout the hamstring, glute max, glute med, glute min. So RDLs, glute bridges, side planks, these are all big exercises I use for helping to take stress off of the knee by building up the glutes and hamstrings. So essentially for helping promote long-term joint protection. So again, the key here is to modify early in rehab, not to stop altogether. The minute you stop altogether, the harder it is going to be to get built back up. You can stay in the gym, keep progressing, and train smart while you are healing. So if this sounds like your situation and you're tired of letting knee pain slow you down, then text STRONG to 732-724-1381 below to learn more about our Return to RX program that has helped countless CrossFit athletes get back to training at full capacity and RXing WODs.